It's not instantaneous. You don't notice that your airspeed is 107 knots and you're supposed to be 137 knots. You don't get 30 extra knots in a second. It has to, take time to build that up. So at 7 seconds.
That the quorum call be rescinded.
Without objection.
Mr. President, what do you get when Congress passes a 2,700-page piece of legislation on a purely partisan basis that radically transforms 1/5 of our economy and impacts the lives of 319 million Americans? What do you get when you impose the huge costs of this legislation and this new bureaucracy that goes along with it on an economy that's just trying to recover from one of the biggest recessions our country has ever experienced back in 2008. Well, two of the things you get for sure, one is higher unemployment, fewer jobs, and the second thing you get is anemic economic growth. And we've seen both of those in the daily news. We now have a new normal, I'm afraid, when it comes to unemployment in America, about 7.6%. But that doesn't even count the people who quit looking for work. The Bureau of Labor Statistics has a ranking of how they rate the number of people actually looking for work. It's called the labor participation rate. It's on their website, the Bureau of Labor Statistics. We have the fewest number of Americans actually in the workforce than we've had in the last 30 years. And we didn't get many of the benefits that were promised when Obamacare was passed. And at a time when we were essentially told, we're from the government, trust us, it'll all turn out okay. But one of the most important numbers in the recent job report is the number of 8.2 million. That's the number of Americans who are now working part-time instead of full-time because the full-time jobs are simply not available. In other words, there are 8.2 million workers who are working part-time even though they want a full-time job because they can't find one. Just to give you some perspective, in March the number was 7.6 million, so between May and June we've seen that number increase by 300,000. 300,000 less Americans able to find full-time work, so they had to accept part-time work. And I know it's tempting when we talk about numbers like this to think that these are just abstractions, but these are the American people. These are moms and dads, brothers and sisters. These are young adults who are looking for work but simply can't find a work on a full-time basis. And I would suggest, and I think the evidence is compelling, that one of the reasons for that is Obamacare. The law requires all businesses with 50 or more full-time workers to provide their employees with government-approved health care coverage, and if they don't, then they have to pay a penalty, a financial penalty. This requirement was originally scheduled to kick in next year, but last week the Obama administration announced that this so-called employer mandate would be delayed until 2015. In other words, the administration has implicitly acknowledged that the mandate is discouraging creation of full-time jobs and is actually reducing working hours, relegating many American workers, 300,000 more between May and June, to part-time work even though they want to work full-time. The irony is that this legislation was passed, I still remember Christmas Eve 2009, 7 a.m. in the morning. The Obamacare bill passed the United States Senate, was later reconciled with the House legislation in 2010, but we've had 2 elections occur before the full implementation of this bill, and what we're going to see now is another moving the implementation off until after the 2014 election. That's dangerous in my view because it means there's no electoral accountability for the true impact of this legislation, even though we're beginning to see some of it. Of course, the basic problem is that the mandate won't magically disappear in 2015, even after it's been delayed by unilateral action of the administration. But it strikes me as pretty simple that when you penalize full-time work, what you're going to get is part-time work in order to avoid the penalty. Of course, the employer mandate isn't the only part of Obamacare that's hampering job creation. The law also contains $1 trillion in tax increases, including a new medical device tax that's already prompted several large manufacturers to close existing facilities or cancel plans for new ones. I remember a few months ago I had a medical device company that's located in Texas tell me that they were going to be expanding their operations in Costa Rica, not Texas, in order to avoid this tax. The medical device tax has also discouraged health care saving and life-saving innovation. I mean, one of the great things about our country and our free enterprise system is if somebody's got a better way to do something, they can design it, they can build it, and consumers can benefit from it. But in this case, this medical device tax has been destructive of each of those. Indeed, this tax has been so counterproductive that 79 members of this Senate, a supermajority on a bipartisan basis, rejected it during the vote on the budget resolution recently and effectively said that it should be repealed. And this includes a number of colleagues across the aisle that supported the legislation initially, but they've now seen that the way this has become implemented can be damaging and destructive, not just of job creation, but access to quality health care. The same thing could be said of the 81 members who voted to abolish Obamacare's IRS 1099 reporting requirement back in 2011. So the more we've learned about the implementation of Obamacare, the less popular it has become. For that matter, the administration itself has had second thoughts about key provisions of Obamacare. In 2010, the Department of Health and Human Services began granting a series of waivers from Obamacare's annual limit requirements, and it eventually granted more than 1,000. In other words, the administration unilaterally said to some people, you don't have to comply with the law, while the rest of us were stuck with it. In 2011, Health and Human Services Secretary Kathleen Sebelius suspended all work on the so-called Class Act, a portion of the Obamacare that was formally repealed earlier this year. And a few months ago, Health and Human Services announced that Obamacare's basic health program would be delayed until 2015, again, after the next midterm congressional election. And just last week, in addition to delaying the employer mandate, the administration also delayed another important provision in the Obamacare oversight. In other words, it said you don't even have to prove that you are financially eligible for taxpayer subsidies to get insurance in the health exchanges. This is an invitation to fraud and abuse. We saw in 2008, when the bubble burst after the financial crisis came to a head, that one of the root causes of that were companies writing loans to people who couldn't qualify for those loans, but they didn't require any financial disclosure or verification. Those came to be known as liar loans. We're essentially now refusing to learn from that experience in the health care field, just to see, on the part of the administration, to see as many people as possible signed up for the health care exchanges, but based only on their unilateral declaration that they are eligible, not any real verification or proof. And that's an invitation to fraud. To add it all up, it's become clear that notwithstanding its aspirations, notwithstanding the hopes and perhaps dreams of those who thought we were going to somehow transform health care with this legislation, it's now become clear to me, and I dare say millions of Americans, that Obamacare has simply not lived up to its promises. It is not working as advertised. And I think there is a growing bipartisan consensus of that. I've mentioned some examples and some reasons why, but the past 3 years we've witnessed a nonstop parade of mix-ups, fumbles, delays, and broken promises. For example, during the 2008 campaign, President Obama pledged that his health care law would transform health care. It would make the health care cost for a family of 4 go down by $2,500. But what's actually happened is that the cost of family premiums have actually gone up by nearly $2,400 between 2009 and 2012. And according to the Wall Street Journal, healthy consumers could see insurance rates double or even triple when they look for individual coverage under Obamacare, and that'll happen this fall. Some of it is the so-called age banding, where young people like my children, my 2 daughters who are 30 and 31 years old, they're going to be forced to pay higher premiums to subsidize health care coverage for older people. There are also other provisions like mandatory issue. For example, if you find out, unfortunately, you've got a disease or and you're not covered under Obamacare, you can go out and buy insurance, which is not actually insurance anymore. It's like someone said is akin to waiting until your house is on fire to buy fire insurance. That drives up the cost and it distorts the insurance market. But what we're going to see and what consumers are going to see is their health care premiums go up as a result of the implementation of Obamacare. And what about the promise that Obamacare wouldn't raise taxes on anyone making under $200,000 a year? In fact, the law raised taxes on everyone, from young people with health savings accounts to middle-class workers with families to senior citizens living on a fixed wage. President Obama also promised that anyone who liked their existing health coverage would be able to keep it. Do you remember that one? If you like what you have, you can keep it. I know people like hearing that because most Americans, into the 80%, maybe higher, are satisfied with the health coverage they have now. So when the President said, if you like what you have, you can keep it, most Americans nodded, said, well, that's good. But the reality is, according to the Congressional Budget Office, that at least 7 million Americans will lose their current health insurance because of Obamacare. A few months ago, one of my constituents in Texas sent me a letter that she had received from her health care provider. The letter informed her that because of the new health care law, the so-called Affordable Care Act, which is turning out to be more unaffordable than affordable, but she was told that her current health policy would be terminated by the end of the year. The letter also said, quote, never have we experienced the uncertainty and immense challenges that confront the insurance industry during this time of health care reform, close quote. Now, Mr. President, I don't think it's sufficient for people like me or anyone else to just criticize this flawed legislation and to say, you know what, I voted against it. It's too bad it didn't work out. Tough luck. That's not sufficient, and that's not doing our duty. There has to be a better way to reform our health care system, and indeed there is a better way. If we commit ourselves to five overarching principles. Number one, we must make health care more affordable. That was the promise of Obamacare, but that's not the reality. It's made health care less affordable, not more affordable. But we must commit ourselves to policies that will make health care more affordable by reining in costs. And I have some ideas on how to do that I'll mention momentarily. The second principle, individuals must have more choices in the health care market. And they must be allowed to make their own choices and select whatever options fits their individual needs. The idea of Obamacare was that one size fits all, but we know one size does not fit all. Different families, different individuals have different needs, and we need to restore the choices to individuals and not to the government dictating what those choices should be. Number three, we must ensure that all individuals, including people with pre-existing conditions, have access to high-quality health insurance and to high-quality care. Now, this was a problem in the pre-existing system, that people with pre-existing conditions found it hard to buy insurance, and this was one of the, I think, noble promises of Obamacare. But we don't have to buy the whole package in order to fix this problem, and indeed there's many high-risk pools at the state level that if the federal government would help support those high-risk pools, that people would be able to find health care coverage even if they had pre-existing conditions, which otherwise would make that difficult to find. Principle number four, we've got to protect the doctor-patient relationship. No one wants to have the bureaucracy telling them what health care they can have and when they can have it. So we've got to protect the doctor-patient relationship. This is a trust, a bond of trust that most of us have with the individuals we entrust our health care to, our own doctor. And we've got to make sure that people are able to make health care decisions in consultation with their doctor and their family that suits their needs. And number five, this is the fifth principle for reform that I think we now need to begin the discussion about undertaking, is we need to save Medicare. Now, what kind of policy reforms might these principles generate? Well, for starters, I would suggest that we need to equalize the tax treatment of health insurance for employers and individuals. This is something we've discussed time and time again, but why do we favor, through subsidies under the tax code, certain types of health care coverage and discriminate against people who buy insurance in the individual market? Secondly, from a policy perspective, consistent with the principles I've mentioned, we need to expand access to tax-free health care savings. There's a company in Texas, actually it has franchises here in the Northeast, Whole Foods. It's a great grocery store, and I had occasion a couple of years ago to meet with a number of the employees. They vote every year on what their health plan should look like, and year after year after year they choose a high-deductible health insurance along with a health care savings plan so that if they really get sick, they're protected by the catastrophic coverage, but otherwise they can save and budget for their ordinary health care needs using a health savings account. And one of the most amazing things about that is people then begin to take some ownership, have some skin in the game in terms of their health care choices, and they tend to do what we do generally as consumers. They shop around. And they say, okay, I've got my money. I need procedure X. I need something. I need this. You know, where can I get that for the best price and the best quality service? These tax-free health savings accounts transform the health care relationship so you don't only just have some third party paying the bills. It's like getting a credit card that you never get the bill for under much of our current health care system. And so expanding tax-free health savings account like the employees at Whole Foods in Austin, Texas, is one great way, one great policy that would improve our health care delivery system. Third, we need to let people and businesses form risk pools in the individual market. And fourth, we need to improve price and quality transparency. There's actually been some good work done by Health and Human Services recently to release health care expenditures for some of the most common procedures and reasons people are hospitalized. I think it's kind of eye-opening because some people have found out that for the same procedure, in one instance you might see $1,000 being charged, in another you might see $5,000 for essentially the same practice or procedure. And providing transparency and indeed creating an opportunity for a market so market discipline can help normalize and bring down those costs, improving price and cost and quality transparency are very important. to creating a true health care marketplace. And fifth, we've done in Texas, we've found ways to curb frivolous medical malpractice lawsuits, which don't shut the front door to the courthouse for truly legitimate claims, but which have made health insurance or medical malpractice insurance more affordable because our civil justice system is more predictable. Number 6, we need to eliminate all the unnecessary government mandates that drive up insurance costs. What happens down in Austin, Texas, and state capitals across the country is legislators come together and they say, you can't sell insurance in our state unless you cover X, Y, and Z. Well, the fact is, not every consumer, not every patient needs X, Y, and Z coverage, but by those mandates, they end up driving up the cost of that health insurance, and what we need to do is eliminate the unnecessary mandates that many people don't use anyway, because those just drive up costs. And by eliminating those mandates, we can help bring down the cost and make health care more affordable. And number 7, this is an old suggestion, but one that I think still is very important. Why is it that you can only buy health insurance in your own state? If I want to buy car insurance, I can buy it anywhere in the country. And I can, the companies in Oklahoma or New Mexico or Indiana, they can compete for my business. And that gives the market an ability to hold down costs, and that gives consumers access to lower costs and better quality by allowing that competition to occur across state lines. So, Mr. President, we don't need another government takeover of our health care system. When the wheels fall off of Obamacare, or in the language of the distinguished chairman of the Senate Finance Committee, if that train wreck of implementation that he predicted occurs, we don't need another big 2,700-page government program to substitute. We need to implement the types of reforms I talked about to give us lower costs, more accessibility, and greater fairness throughout our entire health care system. Speaking of fairness and accessibility, we know the current Medicaid program is broken when our most vulnerable citizens have a hard time finding a physician who will actually take a new Medicaid patient. This is one of the problems that many of us had with the Obamacare expansion of pushing a lot of people onto Medicaid, which in my state is a broken program, where more than 60% of primary care physicians won't take a new Medicaid patient because the reimbursement levels are about 50% of what private insurance would pay a doctor to treat a patient. And so many physicians say, I can't afford to work for 50 cents on the dollar, so I'm just not going to see a new Medicaid patient. So what you have is this strange dichotomy where people actually have coverage under Medicaid, but they don't have access to health care because they can't find a doctor to take it at that price. And that actually, I believe, is sort of the dirty little secret about Medicaid. All of us support a safety net program of health care for our most vulnerable citizens. All of us. But Medicaid, as currently constituted, is not the answer for the reasons I mentioned. Each state must have the flexibility to design a program that will actually meet the needs of their residents. What works best in New York, I guarantee, doesn't work the same way in Texas, and vice versa. States should be appropriated a certain amount of money, and I'm not suggesting it be drastically cut, which would deny the states an opportunity to provide health care in their own way, but we need to block grant these federal funds, not micromanage them, and we certainly need to eliminate as many federal strings as we possibly can. And then provides the states the flexibility to use the same amount of money to provide access to more health care for low-income people. Speaking of access to physicians, this is a big problem in Medicare, too. Of course, Medicaid is for the economically disadvantaged. Medicare is for people 65 and older. But in my state, only 58% of physicians will see a new Medicare patient. That means 42% do not. In other words, if you live in a rural area or you live someplace where physicians won't take a new Medicare patient, you're pretty much out of luck. And this is a problem, again, about the way that the federal government tries to save money in health care, not by using the discipline of the market, transparency and competition, and some of the other reforms that I mentioned, but rather than by whacking reimbursements to health care providers. And the truth is, if you whack reimbursement rates to Medicaid providers and Medicare providers, as we currently do, then fewer and fewer people are actually going to be able to find a doctor who will see them, even though they have the promise of coverage under Medicaid or Medicare. And we know, of course, the financial problems that Medicare is currently suffering. And the fact of the matter is, and this is something I wish we would talk more about, from the President to the halls of Congress, for every dollar that an average person puts into Medicare, they take out $3. And that's why Medicare, in the long run, is unsustainable. And if we're going to keep the promise of Medicare, and we should, to future generations, we need to fix it. But when it comes to treating patients, physicians, I believe, know better than Washington bureaucrats. And this is another reason why I support repeal of another provision of Obamacare, which is called the Independent Payment Advisory Board, so-called IPAB. There's actually bipartisan support for repealing this provision in the House, because what it would do is appoint a group of 15 bureaucrats who would decide what sort of health care was going to be reimbursed under Medicare and which would not. And there'd be no real recourse to Congress or anybody else, because these people would be so-called Independent Payment Advisory Board. And it's not hard to predict what would happen if the IPAB, as it's called, were implemented. When doctors are forced to accept lower rates, they will reduce the number of patients they see, or else they'll drop out of the Medicare program altogether, or the types of treatments that people will be able to get from their doctor will be determined by the federal government's willingness to pay for it or not, rather than their true medical needs. I think we've learned the lesson in Medicaid and Medicare, as elsewhere, that price controls simply don't work, and they won't save Medicare either. It's time to try a new approach that will protect the doctor-patient relationship and expand individual choice. Under the current model, seniors are forced into a one-size-fits-all plan developed here in Washington. Under an alternative, supported, I know, by Republicans and Democrats in different contexts, so-called premium support model, the federal government would pay a designated amount, and then people could use that money to buy their own private coverage. They could supplement it if they wanted to, if they wanted more generous coverage, but that would have to come out of their pocket. But under the premium support model alternative, private plans would be allowed to compete against traditional Medicare, much as Medicare Advantage does now. And seniors can simply pick the plan that they want that suited their needs the most. If someone picks a private plan that's cheaper than a traditional Medicare, they can keep the savings. And then again, if they want a more generous coverage, then they can pay the difference. Well, how do we know this sort of approach will work? Well, you don't have to take my word for it. All we have to do is look at what's working now. One of the most successful government health care programs that I've seen since I've been here in the Senate and that I know about is the Medicare Prescription Drug Coverage Program. A national survey released in October 2012 found that 9 out of 10 seniors are satisfied with their Medicare prescription drug plan. Similar reforms could be made to other parts of Medicare to help save the program. If these reforms are not made, Medicare will go bankrupt. The great thing about Medicare Part D, the prescription drug program, it's actually come in 40% under projected costs. And it's not hard to figure out why. Because when different companies compete in the marketplace for the business of seniors who qualify for Medicare, well, they're going to compete, you guessed it, on price. So they're going to try to provided at a less expensive cost, and they're going to compete based on quality of service. That's the great genius of our free enterprise system and of competition. But if we don't make these reforms, Medicare will go bankrupt, and that's something none of us should look forward to. So, Mr. President, the reforms I've just outlined would give us a health care system with lower costs, a system with greater choice, and greater access to high-quality care, a system that upholds fundamental values such as fairness and consumer choice, and a system that will provide affordable health care for everyone. That's the kind of health care system we all want for our families, for our children and grandchildren. 3 years ago, Congress took a swing at the health care issue, but ended up striking out and missed an opportunity to enact necessary reforms. And we're still learning that as the implementation of Obamacare continues to unfold. But the health care debate isn't over by any means. It's just beginning, in a way, by replacing Obamacare with patient-centered reforms that reduce costs, improve transparency, expand access. We can make it easier for all Americans to get the affordable, quality health care that they deserve. Mr. President, I yield the floor, and I'd suggest the absence of a quorum.
Clerk will call the roll.
Mr. Alexander.
Mr. President,
The Senator from Nevada.
I ask that the quorum call be dispensed with.
Without objection.
I ask unanimous consent to speak as if in morning business.
Without objection.
Thank you, Mr. President. I rise today to address an issue that is troubling to me and to my constituents back in the state of Nevada, to a growing number of Americans across the country. I'm referring, Mr. President, to the tendency of those who lead government agencies to abuse their power and deprive Americans of their constitutional rights. We've seen examples of this alarming trend over the last several weeks. The NSA is reportedly confiscating private emails and phone records. IRS has specifically targeted conservative groups seeking tax-exempt status. Constituents have flooded my office with phone calls, emails, and letters demanding to know why their government continues to encroach on their liberty. They've had enough, and so have I. Recently, the Federal Court of Nevada ruled that the federal government has abused its power in my home state. The court ruled in favor of private cattle owners in Nevada, ranchers who came to the court because they felt the federal government was intentionally interfering with their grazing permits and their private property rights. The court found that for more than 2 decades, federal officials entrusted with responsibility managing public lands actively conspired to deprive Wayne Hage and his father's estate of their grazing permits and their water rights. In its decision, the court ruled, and I'll quote, "The government had abused its discretion through a series of actions designed to strip the estate of its grazing permits and of the ability to use water rights," unquote. The court described the actions of the government officials as an abuse of executive power and said, I quote, "shocked the conscience of the court and provided a basis for finding of irreparable harm," unquote. Mr. President, there seems to be a pattern emerging here. The federal government is supposed to be entrusted with protecting fundamental rights, like property rights and the rights to privacy. And yet, sadly, the American people are left wondering if their own government is living up to that public trust. The framers of the Constitution believed that private property rights were sacred. The Fifth and 14th Amendments specifically prohibited the government from depriving citizens of life, liberty, or property without due process of law. And those amendments are there for a reason. As the Nevada District Court wrote, I quote, "substantive due process protects individuals from arbitrary deprivation of their liberty by government," unquote. No question. Federal government has an obligation to help manage the nation's resources, just like it has the duty to keep Americans safe and to enforce fairly the tax code. But these responsibilities require integrity, accountability, and impartiality, and these powers cannot be used to push political or partisan agendas. In a state like Nevada, which is made up of land that's 87% federally controlled and where resources like water and vegetation are scarce, the role of the government in protecting private property rights is especially important and cannot be abused by overzealous government officials. The rights of cattle owners and ranchers to have their grazing permits honored is no less important than any other form of property rights secured by law through permits and licensing. And the government cannot be allowed to arbitrarily target certain groups for punishment and selectively enforce the law. That kind of behavior is precisely what the framers wanted to guard against. Whether it's the IRS targeting groups for their political views, the NSA confiscating mass amounts of private data, or the federal government interfering with property rights, the American people are fed up with this laundry list of examples of the federal government blatantly disrespecting their constitutional liberties. Fortunately, the federal courts remain open for Americans to defend themselves against government abuse. But I think it's a tragedy for American citizens to be subjected to costly, drawn-out litigation in order to make sure their liberties are secured against the very government they've entrusted to protect them. Mr. President, the American people will not stand for an all-powerful government that ignores their constitutional rights. It's long past time that we end this culture of government bullying and harassment. The government derives its power from the consent of the governed. The consent depends on a fair, transparent, and reasonable enforcement of the law. If we're to remain the greatest country on earth, live up to the powerful ideals that inspire our founders, then we must restore the trust of the American people in their government, and we must begin that process right away. Mr. President, thank you, and I yield the floor. I have a motion. Back to morning business.
Just note the absence of quorum.
Yeah. Mr. President, I note the absence of quorum.
The clerk will call the roll.
Mr. Alexander.
Floor today to talk about the future of student loans for America's students. And when I say students, I have to define what that is, because as we know today, we've got students of all ages. We've got financial impact that's applied to a 19-year-old that's entered for their first freshman year. And depending upon where the income of their family is, depends on whether, under the current system, they get a subsidized loan. And the maximum that they can receive under that subsidized loan as an undergraduate is $3,500. Now, I'd be willing to bet that the President and I both can't pick an institution in our states where the tuition on an annual basis is $3,500. It just doesn't happen today. And that's the reality that's been left out of the debate so far. This debate has been all about politics, and it's not been about students. And it's not been about how to apply affordability as broadly as we can in the marketplace. Let me describe to you where we are today. Between 1965 and 1992, the cap on the student loan program in this country was 10%. 10%. In the mid-2000s, Congress politically said, you know what, we're going to adjust it, and subsidized loans are going to be at 3.4%. And non-subsidized loans are going to be at 6.8%. And graduate loans are going to be at 7.9%. And if you're a parent borrowing, you're going to have an even higher rate. It's in the 8+% range. Now, to me, that strikes me as incredibly unfair, because we take two undergraduates, two 19-year-olds, two enter in the same institution with the same financial obligation, and we say to one, we're going to give you a rate on your student loan that's half of the person that sits in the seat next to you. Half. 3.4% sitting in this chair and 6.8% sitting in this chair. And understand that the person sitting in this chair, depending upon the cost of the institutions, parents may have an income over $100,000 and they may qualify for a federal subsidy. Let me suggest to you that The marketplace is the thing that ought to dictate and decide what the rate is. That's the only thing that's fair to the taxpayers in this country, is the predictability of knowing that it's tied to something. Now, let me suggest to you that the bill that we're going to take up, and we're going to vote on a motion to proceed at 12 o'clock today, is a bill that was created in the 2000s, and 2 years ago we kicked the can down the road and said we're just going to extend this inequitable student loan program, 3.4% for some, 6.8% for others, 7.9%, and 8+% for parents. Why? Because we're overcharging some to subsidize others. Let me say that again. We're overcharging some. We're overcharging some undergraduates, 19-year-old freshmen in college, 6.8%, so that they'll subsidize the 3.4% that we're charging subsidized loans. Now, let me just point to a chart that I've got here, Madam President, and it shows undergraduates under the student loan. And this is a comparison. Let me move to another chart just real quick, because I think this one best displays what I'm talking about. 26% of our nation's kids are undergraduates and subsidized. 55% of the eligible students are either undergraduates or graduate students that fall under a 6.8% interest rate. So when the Senate Majority Leader came to the floor and said some were upstairs trying to negotiate a deal, he was 100% accurate. But the reality is we're still going to have a vote on only one plan at 12 o'clock. There's no option for members of Congress. And what I would suggest to you is that here displays why, at best, there should be two options, and at worst, we ought to vitiate the motion to proceed and see if we can come up with another bipartisan agreement. You see, the option, the Manchin bill, is a bipartisan approach. It's Democrats and Republicans coming together and saying we can agree on something that we think is fair and equitable and financially sustainable. But this is the plan we're going to have a vote on at 12 o'clock. 55% of the population of students, quite frankly, is being screwed. They're overpaying. They're paying 6.8% for interest. It would be hard for any American to be charged 6.8% to borrow money today when a home mortgage for 15 years is 3.8%. Yet we're charging students 6.8%, and we're saying that to go to this is an injustice to our students, where all of a sudden we take 64% of the kids and we treat them all alike and we charge them 3.66%. Something's inherently wrong in the debate that we're having. If this is about kids and about affordability, this is the plan that we should be having the motion to proceed, not this one. This plan merely kicks the can down the road for 12 more months. Now, let me just say, this plan wasn't created by Joe Manchin or Richard Burr or Tom Coburn or Senator King or Senator Alexander. This plan was created by the Congressional Budget Office. The Congressional Budget Office in 2011, in their March report to Congress, they came up with the idea of tying the interest rate to the 10-year Treasury bond. Except the CBO said it should be the 10-year Treasury bond plus 3%. And you know what? That's what Senator Coburn and I introduced. And when Senator Manchin, Senator King, Senator Alexander, Senator Carper, others got involved, we decided that what we needed to do was continue to have a blended rate. But we all agreed that an undergraduate student shouldn't face an interest rate schedule that is not equitable to all undergraduates. So instead of applying it to 26%, we applied it to 100% of the undergraduates. We said, if you're an undergraduate in college, we're going to give you the best rate, which is the 10-year bond plus 1.85. It's fair, it's understandable, it's predictable, it's consistent. A year in advance, you know exactly what your rate's going to be because it's determined based upon the 10-year bond every May. Now, my good friend, who I have great affection for, Senator Harkin, came to the floor. And he said that we were balancing the budget on the back of this student loan program. The student loan program is a $1.3 trillion program. Let me say that again, $1.3 trillion with a T. And based upon the CBO score on this bill, it had a 0.7% surplus. 0.7. Now, by Washington standards, in a billion-dollar program, 0.7 would be a rounding error. This is a $1.3 trillion program, and let me assure the President and my colleagues, this is a rounding error. I can't look everybody in the face and say, might not cost us $100 billion, might save us $100 billion, but we're certainly not balancing a $17 trillion debt on the backs of this student loan program. Let me assure you of that. And for any that suggests that we are, is in fact disingenuous. Let me suggest to you, Madam President, that this is the first time I've been accused of balancing the budget on the backs of our kids. But in 2010, as part of the Health Care Reform Act, Democrats ended the Federal Family Education Loan Program, FEEL, at a savings of $61 billion. Of that, the Democrats directed $19 billion to deficit reduction and the rest to help pay for Obamacare, or the Affordable Care Act. If I'm being accused of balancing the budget on 0.7% determined by CBO, and in 2010 the Democrats voted to eliminate the FEL program and save $61 billion and applied $19 billion to deficit reduction and the rest to help for the Affordable Care Act, then they plowed this ground long before me. As a matter of fact, in 2007, as part of the College Cost Reduction and Access Act, the Democrats found $21 billion in savings and spent a good amount of it on new programs, and then directed $1 billion to deficit reduction. I said earlier, I have great affection for Senator Harkin. And Senator Harkin said, well, this should be part of the Higher Education Reauthorization Act that may or may not happen next year. Well, we made changes to the interest rate on student loans outside of the Higher Education Reauthorization in 2012 with a one-year extension of the 3.4%. We did it in 2010 with the elimination of the FELP program. We did it in 2005 under the CCRAA, the Deficit Reduction Act. Senator Harkin's Appropriations Committee has made changes to the eligibility rules for Pell Grants each of the past several years outside of the higher education authorization, including elimination of summer eligibility, ability to benefit, and lower of the automatic enrollment for low-income students. I mean, it's just not fair to come and say to me that I'm doing it outside of higher education reauthorization when there's a track record continually of the person that accused us of doing it himself. Let me say that he is accurate. I'd be happy to yield.
If I could, first of all, I want to thank the good senator for working in such a bipartisan manner. And I think this truly is a bipartisan bill. If this bill has been described as belonging to one party or the other, it's wrong. We sit down, and I think that Senator from North Carolina, Senator Burr, and Senator Alexander, and Senator Coburn, myself, Senator King, and we had Senator Carper, and looked at basically how we could fix something. And I think we looked at it from the standpoint that this deadline hit. We knew 1 year ago when we extended it, they said it was a political atmosphere, we had to extend it. And we knew that year would come, and if, like everything else that's happened here for the last 2 or 3 years, nothing gets done. So we just said enough was enough. It has to be fixed. And if you want to fix it, look at the whole program. You had to understand the programs. I think now they're saying that, accusing that the students are paying profit so that we can pay down debt. whether there's profit built in or not, depending on the accounting procedures that's used by our federal government, it was built in. You can blame whoever you want to blame, but it's built into it. We've got to deal with the facts in front. So, Senator, I think what I would ask, we have proven that we're willing, all of us have agreed in a bipartisan manner, no profit will be made on the backs of students, what we can determine through our bill that we're working on, right?
Incorrect.
So we've all come to that agreement as Democrats and Republicans, no profit for debt reduction. It should all go in lowering the rates, correct?
That's correct.
Okay, so we've agreed to that. We've agreed on a long-term fix, 10 years versus kicking it down the road for another year, knowing another year will come and go, and we'll probably be sitting here again debating it. That's what we've come to the conclusion. And we've also agreed, which is different than what the House sent us, and I applaud you all for working with us, to put a fixed rate. So if it's at 3.66 this year and I borrow, and I'm able to qualify, I'm subsidized at $3,500, a subsidized loan that the taxpayers will be paying, that 3.66 is fixed for the full life of the loan. We agreed on that, correct?
That's correct.
So these are things that we've come, and when they say it's the Republican bill or that's so erroneous, and it's just not fair. This is truly a bipartisan effort, and we're working with all of the colleagues in my caucus, and I know you all in your caucus, to understand that if I'm a subsidized Stafford loan, that means that the federal government, the taxpayers of this country, will pay my interest while I'm in school, correct?
That's correct.
At the end of that, then I pick up whatever interest rates that have accumulated when I was in school, and I take it from that day forward. What they didn't understand, and I think what a lot of our colleagues don't understand, I can't make it just on that $3,500. I've got to go and borrow more money. So now I'm borrowing money. If I go with my colleagues on the Democrat side, I've got to borrow all that at 6.8%. We were able, Senator, in a bipartisan way to bring that to what, 3.66 for all undergraduates, correct?
You're correct, and I might add to my good friend that this chart shows exactly what he talked about, that under the plan that we will vote at 12 o'clock, because of the need for students in the subsidized category to borrow additional money at 6.8%, at the end of their process, they owe $78 a month, where under the bipartisan bill, where every undergraduate is treated the same, they owe $75. It's actually cheaper, even for the undergrads that are subsidized.
But what I'm saying is, the money that I have to borrow, even though I qualify because of my income for a subsidized loan, I don't have to pay the interest on an annual basis. I don't make it on that, so I do have to pay it. So by bringing it down to one low rate, I make a much lower payment. It's less obligation, it's less hardship on me as a college student to make that lower payment than it would be to make the higher payment, just because the optics were, we want to help the subsidized, the really poor kids. I might be poor, but I can't make it on just what you'll give me because I'm poor. I got to have a little bit more help. And we're not looking at the whole picture here. And then on top of that, I want to go to graduate school after I get my college degree. Then you bump me up, I'm at 6.8 again. Ours brings it down to 5.21, which is more savings, which the Senator, I know, agrees to. Senator, if I may, and I might ask our Senator from Tennessee, my colleague from Tennessee, whoever would like to start to talk about this, but let's say that right now we know we have a consolidated cap at 8.25%. So let's say that I graduated and I went to school during high recession times. So at the end, I have an 8.75% accumulative interest I owe. I can cap that and go in and consolidate 8.25, correct? Senator from Tennessee?
If I may respond to the senator from
Absolutely.
West Virginia. First, I'd want to congratulate Senators Manchin and Burr for helping the full Senate understand this issue. This is like a lot of issues we have to face, not simple. I mean, I used to be a college president. I used to be the United States Secretary of Education. I had to re-educate myself on this legislation, I still made some mistakes. I was saying last night, for example, that there were only 2 million subsidized loans. And what I was forgetting was the point that the senator from West Virginia makes, which was 80% of the students who have subsidized loans, the low-income students, also have the unsubsidized loans. So when you only take care of these subsidized loans, you're leaving 7 million students with unsubsidized loans up here hanging high and dry, and nobody's taking care of them. So you're hurting both the middle-income families and the low-income families when you have an incomplete solution. But the question, the senator from West Virginia posed the question, is it right that, let's say I graduate from the University of Tennessee and I've had 2 loans. I've had the subsidized loan, and that means the government's been paying my interest while I'm in college. And typically, if I'm like 4 out of 5 students, I've had a unsubsidized loan, so I've paid that interest. And suddenly the interest rates have gone up for me because, well, the interest rates have gone up to 10%. What I can do is take both those loans, I could take all my government loans at once and turn them into an 8.25% loan. So that's in effect a cap on my loan. And that means, and then I would have the choice, and I would say this back to the senator from West Virginia or North Carolina, when I consolidate my loan at 8.25%, I've heard some senators say, well, that just means the student's going to have to pay a lot of interest because it spreads the loan out over a long period of time. But does not the student have that choice? I mean, isn't it like if you want a 15-year mortgage, you have higher monthly payments, but you pay less interest because you pay it off quick. But
what they're referring to, and it might be misunderstood, Senator, if I may, is that everyone will take the longest period of time.
Mm-hmm.
I'm understanding, and I think I'm accurate and correct on this, that, okay, I want the smallest payment. I just got out of school, so I want my smallest payment. Now I'm getting better jobs 4 or 5 years out. I got a better job. Instead of paying $150 a month, I can afford to pay $300 or $400 on my. There is no penalty for me to shorten that, as it would be in a conventional market. Is that how you understand it?
The senator would, Madam President, I'd ask consent that the senator from North Carolina and West Virginia and I be permitted to engage in a colloquy for a few minutes.
Without objection.
That's how I understand. I would say to the senator from North Carolina, if I would presume a graduate of the University of North Carolina would be smart enough to make that decision for herself or himself, wouldn't you think?
Well, I think they would. I think one of the agreements that we came to was that students ought to be in control of their decisions about their loan rate based upon what was available to them. And if a student goes through the next 4 years and they have a combined interest rate of about 4.5% for the life of the loan, why in the world would they be excited at an 8.25? If for some reason 10 years from now somebody got out of school and their combined interest rate was 9%, we give them the option of going back to 8.25. And I think the senator from West Virginia made an extremely good point. For the most subsidized student, they can only borrow $3,500 that's subsidized.